October is Breast Cancer Awareness Month, and it is so important that women are getting screened through mammograms and that they know options available throughout the entire process. We are very, very lucky here in Kentucky to have a collaborative efforts with the UK Markey Cancer Center Affiliate Network, Clark Clinic Oncology, and Georgetown Cancer Center, all able to offer patients the newest treatment options and emerging technologies. We appreciate we have two doctors from the centers here with us today, Dr. Kent Taylor and Dr. Mark Bernard. Thank you both so much for joining us.
Hi.
Thank you for having us.
Glad to be here.
We appreciate you taking the time to talk with us. And so many women have so many questions and either don't know what to do or where to go or what even do first step. So let's just start at the beginning. Dr. Taylor, why is it so important that women are getting mammograms?
Sure. Mammograms still the standard screening tool for breast cancer. A lot of debate in the last few years of can you go from an annual mammogram to an every other year mammogram? And various national bodies have recommended different approaches. Usually for most patients I see, annual mammogram is still recommended, especially in ladies that have either a personal risk of breast biopsy or if they have a family history of breast cancer. Definitely annual mammogram is the way to go. Most women that I meet have had their annual screening mammogram, and often I meet them either, well, there's been an abnormality or there has been a biopsy of some kind that has led to someone meeting someone like myself. Obviously, that's something that, you know, for ladies can be very distressing, and it's something that one of the things that we're here, especially as a medical oncologist, is well, now you've had this abnormal imaging, or now you've had this mammogram or subsequent biopsy that now you've been diagnosed with a breast cancer. Well, where do you go from there?
And these are all major questions. I'm glad you brought it to attention that women are nervous when this happens. I mean, understandably so. Mm-hmm. Let's add in something that's happened this year that nobody could have expected, COVID-19. They're even more worried. Why is it so much more important now to feel safe in the environment, and what kind of precautions are being taken so that women don't have to worry about this?
Well, I think that, you know, with the unexpected pandemic and the ramifications of it, the mammogram center here in Georgetown has been having, unfortunately, some delays of ladies getting their mammograms. Now, the American Society of Clinical Oncology made some recommendations over the summer of, well, if you can delay some things, you know, to avoid public health issues and things like that, or kind of a, you know, good dividing of resources and things like that, it might be safe to delay for a little bit. But most people are still getting annual mammograms. And it's something that I know at our institution, they're doing everything they can from a cleaning standpoint, everything they can from a social distancing standpoint. But I think the still number one thing is it's very important to have a mammogram. And if that's delayed by a few months, well, that's better than delaying for like 1 year.
Better late than never, basically breaking it down in terms.
Correct, yes.
Well, Dr. Taylor, talk a little bit about your cancer program and your affiliation with UK Markey Cancer Center.
Sure. So we're a part of the Markey Affiliate Network. It's something that's an organization that's been around for a few years now. It's basically trying to take the quality care from Markey and have affiliations throughout the community so that patients have better access to not only clinical trials, but also services that UK Hospital and the Markey Cancer Center provides that are not available in some communities. It's a tremendous resource to have the access that we do, because you can get your treatment close to home, but if you need treatment that is not provided in your community, we have very good access and working relationship with the Markey Cancer Center.
Which I'm sure women appreciate, because going through this process is already stressful enough to have to travel to different treatments, to not have all the different options in such a small area seems like it would cause more problems as far as mentally and maybe even with the healing process. So what you're doing is really helping women just have every possible access point within their reach.
Yes. The breast cancer diagnosis, unfortunately, is a stressful time. is something that you're trying to make things as seamless and smooth as possible during that difficult time. It's also something that, especially with emphasis on screening, you're hoping to catch ladies in an early stage of breast cancer where the outcomes are very good and the survival is 95% or better. And it's something that, if you're one of the patients that are fortunate to find yourself in that situation, trying to get everything they need to have for treatment is great, but it's also something, as you touched on, there's a lot of mental aspect of breast cancer diagnosis. There's also the stress on family, stress on caregivers, and things like that, that if you can smoothly take someone through that journey and things go well without them having a lot of problems or a lot of side effects, people recover well, and it's something that you can look at breast cancer as something that the patient has had, not something that kind of defines them for the rest of their lives. And I think that, to me, being in my role as the medical oncologist, is a big goal, is helping ladies transition through their care, but then after their care is over, transition to, hey, this is the rest of your life, and do well, live well.